My name is Dr. Aaron Carter. I'm an orthopedic surgeon at Town Center Orthopedics. Today, we're going to be talking about hip pain and why it's important in terms of diagnosis and treatment for your common hip problems. The hip is a remarkable ball and socket joint where the ball is the upper part of the femur and it fits snugly into the pelvis, into the cup of the hip joint, which is called the acetabulum. Of importance, there is a cartilage ring that sits around the acetabulum called the labrum. Hip pain can be localized to either the front, the side, or the back of the hip, and that does give us information as to where your hip pain may be originating from. In the front, typically pain can be related to either a tendon that sits in the front of the hip or inflammation in the joint or the labrum. On the outside part of the hip, you can have pain along the trochanter, which is the outside part of the femur or the thigh bone. In the back part of the hip, if you're having pain in the buttocks or where your sit bone is, sometimes that can point to discomfort arising from tendons or sometimes nerves that live in the back of the hip. If you're experiencing pain in the front of the hip, movements that may exacerbate this could be hip flexion and then internal or external rotation at the hip joint. This may point to either pathology related to the labrum or other conditions such as arthritis or wear of the cartilage within the joint. Typical treatments for this involve physical therapy, sometimes injections, and ultimately, if these do not seem to cause improvement in symptoms, then surgery may be an option. An accurate diagnosis is important with hip pain because there are many different causes of why you may be having discomfort in the pelvis or within the hip joint itself. If somebody is experiencing hip pain, they should come see us in one of our offices where we can obtain a baseline examination, imaging, and then find ways to treat your hip pain.